Greetings and welcome. You are watching This Is My Health. Here we seek to inform you so that you can take control of your own health. Today, again, we are at the market. We've got fruits, we've got vegetables, and we are going to be having a visitor who is going to give us more information on some of the issues that we have to deal with. Please join me as we welcome our guest for today. Welcome.
Thank you.
Please have a seat. It's been a long time since you have had a lady doctor visit us at our store, so it's good to have somebody. Welcome.
I'm happy to be here.
Yes, ma'am. Can you please introduce yourself for the sake of our audience?
Okay, my name is Dr. Monica Mazerere.
Okay. Today, Doc, I would like us to talk a little bit about the issue of allergies. So, help me start unpacking. What are allergies?
Okay, so allergies are when the body overreacts or when the body is hypersensitive to a substance or a food that is usually harmless.
I like that. So, the substance doesn't have to be harmful in its own context. No. It's generally seen as harmless, but for that particular person, there is something wrong there. Are there things that are common allergies, or is everything an allergen?
There are common allergens, such as peanuts or pollen, but anything can be an allergy.
Oh. So what usually happens to the body and to the person? How does one know that, oh, I must have an allergy for this? You know, that word seems to be used loosely.
So there are specific symptoms, or let me just say common symptoms of allergies, where after the exposure, after you're exposed, there are certain symptoms like itching or a little cough or a skin rash that may show you that you are reacting negatively to something.
Okay. That sounds harmless. How come allergies are such a big topic if all you get is a little rash, a little cough? Can they be serious?
Yes. So allergic reactions can be mild and you can manage them at home even by avoiding the cause. But they can go up to life-threatening conditions where someone now they are in shock and the BP goes down and their inside is just inflamed and red and swollen.
Are there records, or maybe you would know of somebody who has had a severe, maybe you can describe what happened?
Okay, so usually when someone has a severe, when someone has a severe allergic reaction, they start having difficulty breathing and they have severe pain because of this redness and swelling that's inside, and they may even have difficulty breathing. So some may need even to be admitted in hospital for treatment, short-term treatment.
I've heard of people dying from allergies. Can they kill?
It is very true. Some allergies, some allergic reactions are so severe that they can lead to loss of life.
What are some of the things that can give somebody an allergy that would actually be life-threatening?
Peanut allergy, it can be a life-threatening allergy, and some drug allergies. They may cause the entire body to be affected and affect all the different systems of the body and make the organs of the body to just shut down.
Does it actually matter how much one takes? Because you say it can be mild, moderate. Is it dose related?
It is dose related because if it's only that even like for peanut allergies and other allergies, even a trace of the insulting substance can cause a reaction. But I guess the more you are exposed to, the more reaction of the body.
Why I'm asking if it's like that, because I see sometimes, on food, if you look at food packaging, they sometimes can write that this was packed in a place where there are nuts. And I've often wondered what's important about that. I mean, it's not like there's nuts or something inside. It's just they were packed there. Why is it so important?
This is so true because remember the system is hypersensitive. If it detects that allergen, it just reacts. So it's actually overreacting. So if the system detects that there are peanuts here or there's an allergen here, it starts to all that process of reacting to the allergies. The immune system starts to act, and the person starts to have those symptoms.
So, would you say if somebody has got allergies, they should learn to read? I'm just saying that because at least the thing that pops in my mind is that I've seen it written, and I'm just wondering, how then would I know?
Definitely, we should read ingredients, and you should be hyper vigilant and know what makes you sick and avoid. Avoidance is a very big part of the management of allergies and asthma, hay fever, and all these related conditions.
So now I would like to go into the people who can't read. I was just asking about that because that will be somebody who they can read, and necessarily I'm looking at children.
Yes.
I imagine that somebody starts allergies when they're young. Maybe I'm wrong. At which age can I develop an allergy when I'm already older? Maybe I should have asked that first without just assuming. Maybe
most allergies start in childhood. Even a newborn baby can react. They are troubled by rashes. They can react to soap. Some people are allergic to lotions. But an adult can develop allergies when they are now old, yes.
Oh, okay.
Though their immune system are not as sensitive as younger people.
Okay.
Children can also have they can also have allergic reactions.
So now, how is a child supposed to know that they may be allergic to something if they have never in contact with that something?
Yes. So they may not know, but a baby starts solid food at 6 months. So a mother should start cautiously to introduce this food so that if anything is not good for the baby, they are able to see which one it is. But if you introduce too many foods and the baby reacts, it will be difficult to pick
which one.
Okay. But usually an allergic reaction happens like in a short time. So you are able to trace back because even when you have diarrhea, you're able to suspect which food caused. So if you are vigilant and alert, you are able to pick which foods are not in line with your immune system.
Can somebody be allergic to milk?
Yes.
Because you said a baby introduced solid foods at 6 months. The thinking being, milk is just fine, but it's only when the solid food comes in. So I need to ask, can somebody be allergic to milk? Can a baby be allergic to milk?
There's another condition called food intolerance.
Is there a difference?
There's a difference, but it's similar because usually people are intolerant to milk when they take it. Usually the symptoms may come after some time where there's inflammation and a little diarrhea. But some babies are allergic to cow's milk and they are put on soy-based milk.
How do I distinguish food intolerance from actual allergy? Can it be distinguished?
Yes, it can.
Okay.
Yes, allergies usually start immediately. And food intolerance may start after some time. So the difference is that allergies are caused by the immune system reacting immediately. But food intolerance, the immune system is not involved. It's just, for example, after taking milk, then because of the bacteria in your gut, there's gas and discomfort. So the person still has to avoid that food that they're intolerant to.
Okay. Can somebody then outgrow, let's go with the intolerance. I like this because I think many of us can't actually distinguish the two. You hear people saying, I'm allergic to this, and according to your definition, it's not really an allergy.
Yes.
If somebody starts off being intolerant, can they later be able to take that food?
Yes. So you understand that like these conditions, they vary from person to person. Some people have very mild disease, some have very severe disease. So some people after some time they recover fully, but others it may be a chronic or a lifelong condition. So some people may outgrow
The intolerance.
the intolerance because your as your system matures, it becomes less sensitive.
Can you develop intolerance later in life?
Yes.
How come? I thought you said as you mature. So, yes.
So we never say never or always. So it can happen. It's just rarely because it usually starts when
What
you're
sort of
younger.
things would trigger an intolerance later in life? If you have been eating something and now suddenly it makes you sick, according to what you say.
If there's a change, remember that. Let me just give an example. If you have to use antibiotics for a certain condition, it may change the bacteria balance in your system. Yes, and certain diseases also they develop late. Say a woman has another autoimmune disease that came late and comes with those symptoms.
What's an autoimmune disease? Out here in the marketplace, you bring a big word, you have to explain that.
Yeah, so these are similar conditions where the body just fights itself because even allergies, you can be allergic to something that's inside or outside. There are people who are allergic to exercise. There are people who feel short of breath when they exercise and have the...
I think unfortunately we are running out of time. So we are going to go for a break. When we come back, I want to hear more about allergies, especially how somebody becomes allergic to exercise. I'm sure that people want to hear more about that. Please don't go away. We'll be right back. Welcome back. If you've only just joined us, we are looking at allergies. And in case you are wondering as to where we are at the marketplace discussing non-communicable diseases, looking at fruits and vegetables and being at a place where any one of us at any point can be, but still should be able to talk about these conditions because they are so common. In the studio, I've got Dr. Monica. We have agreed I'll call her Dr. Monica. Welcome, Doc.
Thank you.
When we left, we had just finished trying to help us distinguish between intolerance, food intolerance, and allergies. And then you had gone on to chip onto allergies, and you were talking about people being allergic to very, very common things, like exercise.
Yes.
I think I would like to unpack that a little bit more so that I'm sure I have not misunderstood you.
Yes.
What are allergies again? So that when we start saying you are allergic to some of these things, we are in the same wavelength.
So allergy is a hypersensitivity to an unharmful substance. The body mistakenly detects that as an invading substance and overreacts.
Okay. I wanted to hear that because I want to go into start understanding how does one get allergic to exercise? What does that mean, Doc?
So everything that happens in your body, certain hormones or certain substances are released. So we know that when you exercise, certain happy hormones or other things are released, and your body may mistakenly overreact to that. Some people, when they exercise, they start wheezing and having difficulty in breathing.
Would we call that an allergy?
It is an allergic reaction.
I think that we are going to have a lot of discussion and research on that. Okay, can you be allergic, for example, to something as nice as this, an orange?
Yes.
You can have allergies to that.
You can have an allergy to an orange, but it's rare.
Yeah, so an allergy to an orange is not necessarily food intolerance. Can you distinguish that again? How does somebody who overreacts to an orange differ from somebody who is just intolerant?
So if it's an allergy, the immune system is involved, and the symptoms are usually itching, There may be fever and redness.
They may get sores and the like.
Yes.
Yeah. But intolerance
But if it's intolerance, the symptoms are more like discomfort, indigestion. The food doesn't go with the digestive system.
Okay. So other things that are common, like water. Can somebody be allergic to water?
You can be allergic to water, but it's a very rare allergy.
And what would happen to the, let's say, bathing water? I know that when I say water, people are thinking, okay, water, drinking it, water bathing. There are people out there who want to be saying, I am allergic to water bathing. Can somebody be allergic to bathing water?
Some people are allergic to bathing water. When they bath, their skin erupts. They get eruptions and start to itch. And there are extreme cases where people struggle day to day because they're allergic to water. But it's a very rare
Have you ever met somebody
condition.
Like that?
I've seen documentaries, but I know that it's common for people usually when they bath in the evening to say, now I'm itching, now I have rash.
That's my point. That's not allergy.
It is an allergy.
Is it?
It's an allergy.
I'm going to pack that one. I'm sure there's going to be a whole lot of discussion. Why I'm saying that is I'm imagining that there can be different things in the water. Maybe the person is not necessarily allergic to the water itself.
That's true.
But it's possible that maybe this water has got more of one substance. Sometimes we hear of water having more fluoride.
Yes,
I've seen people who have got teeth that are brown because there's more fluoride. So I'm imagining that maybe there are things that are in the water rather than water itself.
Yeah.
Anyway, it's just it's not counterintuitive. It's just me thinking aloud here. Okay, now I want us to go back now to seriously to allergies and babies and this condition called asthma.
Yes.
Because you said that when people have got allergies, more often than not, they'll present with difficulty in breathing.
Yes.
And we have had somebody come here telling us that asthma is shown as difficulty in breathing. I don't know. How would you define asthma?
Asthma. So asthma, allergies, and hay fever, they are related. Mm-hmm. So in asthma, this is now your respiratory tract. It's hypersensitive. Mm-hmm. It's your immune system is hypersensitive to what we call allergens. Mm-hmm. So examples of allergens may be dust or pollen.
So allergens are those things that cause allergic reaction,
yes,
right?
That cause the reaction. Okay. But now in asthma, the symptoms are difficulty breathing because inside your trachea, your respiratory system, there will be swelling and redness and the narrowing of your respiratory tract. Mm-hmm, mm-hmm. And also there tends to be more mucus production, which causes more obstruction. Mm-hmm, mm-hmm. So the symptoms vary from mild to severe.
Mm-hmm, mm-hmm. I've known of people who have died from asthma.
Yes.
So I imagine that it must be something very serious. So at which age does the asthma normally present?
Asthma, there is a condition called bronchiolitis. It's the same condition. It affects children who are less than 2 months. It can start from babyhood, mm-hmm. school-going children, but it can start later in life. Mm-hmm. It affects any age.
At any age, okay. So if somebody gets the asthmatic attack, like you were saying earlier, is the advice still the same to avoid the allergen? Because that's what you said earlier with allergies. So I'm wondering, how does somebody prevent asthma?
Prevent an attack. Mm-hmm. So the first thing is to avoid allergens, mm-hmm. to be aware of what allergens trigger the asthma, mm-hmm. and also. So this means making sure that the house is not dusty and you can avoid mats. Mm-hmm. Sometimes the allergens are on you. You spend the whole day exposed, so when you come home, wash your hair, change your clothes, you might...
You as in the parent versus the child?
Both of you. Oh, yes, because if a little dust on your clothes can make the child feel uneasy or unwell. Mm-hmm, mm-hmm.
But, so you say when you come home, sorry, I interrupted you.
So when you come home, you may have to change your clothes and wash your hair to reduce the allergens that may be making the child at home feel unwell. Mm-hmm, mm-hmm. You may have to close the windows so that, especially for patients, some people have seasonal asthma when it's spring and there's pollen. That's when they are not well. But other times of the year they are well, but other people have asthma that can be any time because it has a different trigger.
Okay. So if you have seasonal, you started by close the window and then you moved. I just wanted to hear more about that.
Yes, you avoid the pollen and avoid exposure. You use masks.
Okay.
Yes.
Okay. Well, now that we have had COVID-19, it seems to be acceptable to go around in a mask.
It's easy.
I can imagine the time that before we had that, how difficult it must have been with that.
It was.
Okay, now with babies and young people, can they also be put on treatment for asthma? And what sort of treatment for asthma is there, other than the prevention which you have just talked about?
Yes. So there are medications for asthma. They are divided into two, relief and control. So relief is when you are having an attack. You are given a spray that you can use that opens up the airway at that time. But there are medications that you should take every day. There are also sprays that you can use every day. They prevent attacks. So they keep you from having attacks. You use them to avoid severe asthma.
And do children also use such sprays?
Yes, children, because it's difficult to give them instructions. For them to use a spray, there's a hollow
chamber of sorts.
Yeah, it's called a spacer. You spray it and you allow them to breathe in the medication. Then they'll feel better.
Okay. Now, I don't know if you're not aware of this, it's fine. You can say you don't know, but I'm asking because I know my audience is probably thinking about that.
Okay.
Are there herbs out there that can be used to control the asthma or treat asthma? If you don't know, it's okay. Because I know you are a doctor, but I'm just asking. Sometimes some doctors meet patients who use such things and are doing fine on them.
Okay. We are just aware that certain herbs like garlic, ginger are good for the respiratory system. And for colds, they may have similar symptoms as asthma.
Okay.
Yes.
So maybe there should be more research to be done in those areas. I'm just asking that because I've heard some parents who come and say, no, we've got these kinds of herbs that you are working on. Maybe someday I'll bring somebody who will come in here and share with me about herbs. Now, our time is running out. Before we let you go, I would like to know if there is any parting message that you would like to share with our audience.
I would like to say that prevention is the way to go, but we must understand that sometimes a disease is difficult to control. I know there are people who may say we don't want to take medication because medication worsens symptoms. Those are misconceptions. Medication was made to help patients to feel better. So if you have to take, there are parents who refuse for their children to take the symptom relieving medication. So this is not acceptable, as the aim of the healthcare workers is to help the child to feel symptom free and not to have severe or life-threatening disease.
Thank you very much for coming. It's always a pleasure to hear what doctors have to say. Okay. Thank you very much for joining us today. I hope you have learned something. I have learned that there is a big difference between food intolerance and allergic reactions. Sometimes I have understood it can be difficult to tell them apart, but an allergic reaction is an immune reaction. An immune reaction means that when you are exposed to something that your body cannot tolerate, it sets up a lot of activities in the body, which then leaves the body to react in things like maybe you start to itch, maybe you start to having trouble to breathe. Basically, a lot of places begin to swell and produce various chemicals that make the situation worse for you. Whilst on the other hand, intolerance may not happen immediately. And most of the time, intolerance, we are talking about food, whereby when that goes into the body, by the time it gets to the tummy, the reaction between your tummy and your salts and your bacteria, out of all those things, bring out the reaction like you may have diarrhea, you may have vomiting. So that is a major distinction between the two. I've also learned that the best treatment for any of these conditions is first observation. Observe which sort of things trigger, be it intolerance or an allergic reaction. And then you are better off avoiding those things rather than trying to treat. I've also learned that reaction of the body to things that the body doesn't like can become very severe. You can have a very mild one that you can sort out very quickly. It can be one that you may need somebody to help you with, but it can become so severe that you have to go to the hospital, and others you may not even make it to the hospital. So it is in our interest as parents to pay attention when we find out that you are having a child who seems to have some reaction whenever they're exposed to something, because that kind of paying attention may actually be life-saving. I've also learned that today an allergic reaction is not necessarily to something that we perceive as bad. Therefore, sometimes we may be wanting to give somebody something that we believe this is good for you. Milk is good for you. Apple is good for you. Or fruit is good for you. There are many things that are good for us. But that particular person may have a situation in their body that it is not so good for them. If somebody is reacting to something, let us be cautious and not just force them to take the thing that they are reacting to. Lastly, for those of us with children that have got asthma, let us be responsible. Teach them how to take their sprays, and let's not always resist the doctor's advice to help our children or even ourselves with the sprays, because it can be life-saving. It has been a pleasure to be with you on This Is My Health. Look after yourself. And until next time, God bless you, and keep on saying, this is my health, and claim your health for yourself. Goodbye.